5 minutes of questioning.
Thank you, Mr. Chairman, and thank you to the witnesses for participating today. We're in this committee today discussing various proposals that would improve access to health care services covered by Medicare, while seniors, families, and small business owners across the country saw their premiums skyrocket last month after Republicans failed to extend the ACA tax credit, premium tax credits before January 1st. These tax credits are a lifeline and help make health care coverage affordable at times when the cost of living continues to climb. I stand with Leader Jeffries and my Democratic colleagues on this committee as we continue to fix and fight for an extension of the tax credits to make health care affordable for all Americans, and I underscore all Americans, not Democrats, not Republicans, not independents, but all Americans. The fallacy that this only impacts some and doesn't impact others is something that we must at all costs dismiss. Mr. Lipschultz, thank you for joining us. Louisiana has one of the highest percentages of MA enrollees in the country, many of whom will live in my district. Given how many of my constituents get their health care through MA plans, it's important to me that they have the information they need to make the best decision about their health care, which also includes choosing the supplemental benefits that best meets their needs. Can you talk more about how collecting supplemental benefit data from MA plans help seniors and why it's important for these plans to notify beneficiaries of their benefits?
Thank you for the question. So Medicare Advantage plans use their considerable payments in part to offer supplemental benefits to their enrollees. They often use these supplemental benefits heavily in marketing to try to entice people to enroll. And oftentimes, for example, we will hear about people drawn to so-called flex cards that are essentially debit cards that, among other things, could be used to purchase over-the-counter items. And we hear stories of people contacting the SHIP programs, State Health Insurance Assistance Programs, asking what plan will give them the highest value card while disregarding all the more important considerations, like, do my doctors contract with the plan? What services are covered? What kind of prior authorization will I be subject to? We also hear from folks who are drawn to supplemental benefits, say a dental benefit, for example, but when they're enrolled in the plan, they find out that they have trouble finding a provider that will take their plan, or their services are capped at a far lower level than they believed. So what this bill would do would help gather information to give the public and give the Medicare program a better idea of what services are being offered, who is using them, and to what extent, how much it is costing folks, and if people are actually getting value out of these services for which we pay plans considerably.
So how do we better educate? Because we know that many people are either hoodwinked into going into, as you suggested, a plan that has greater variables that may not very well be the best fit for their true medical coverage. How do we, listening from this committee and working with our other agencies back home, how do we do a better job at making sure that we educate people on these MA options?
So we just discussed one of the bills being evaluated today that would increase requirements for collection of data on supplemental benefits. I'll pivot to the other bill that would extend MIPA funding for key community organizations like state health insurance assistance programs, AAAs, ADRCs, and others. Part of that funding goes exactly towards trying to provide people with information about their Medicare coverage options, primarily through the SHIP programs. The best way, in my view, to help educate people is to invest even more into the SHIP program, which is really the only source of pure, unbiased information where counselors there have no stake in someone's decision. They have no financial stake. And contrast that with the billions of dollars spent annually on marketing and commissions, all aimed to try to convince people to enroll in certain plans to the benefit of the people who are paying those commissions and ads, but not necessarily to the benefit of enrollees. So we need more unbiased, neutral information that can help people understand their options. And that's where I would suggest Congress focus its attention.
Hence the transparency measure that my dear colleague Jennifer McClendon will be offering. And I fully support the representative's effort because it makes all the sense in the world to create. We talk about transparency all the time, but it seems to be more selective than it should be. Transparency should be universal. This measure will in fact do that. It will save lots of money and opportunities for people to be better educated and have their health care more accessible. Thank you very much. My time is up. I yield.
Gentleman yields back now. Recognize the gentleman from Ohio.